Today we're going to be listening to one of the main dentists, Dr. Khoa Nguyen. He's going to talk to us about 7 of our most frequently asked questions. If you have any immediate questions, send them to forestwooddental@gmail.com or text us at 281-843-5376. So let's start off with some of our most frequently asked general questions. What brand of toothpaste should I use?
All right. So brand actually is more dictated on your needs. There are people where cavities is their primary concern, in which really that needs to be any kind of toothpaste that has fluoride. Now, with gum disease, just within the last 2 years, there was a brand of toothpaste that was developed that's specific for gum disease, where the fluoride has been charged in a way to where it can effectively penetrate the bacteria that's underneath the gums and kill them off. Now, that brand, Sensodyne, but it's a red label box. It's called Pantodontics. That would be the main toothpaste for anyone who has gum disease or gingivitis that they're trying to control. People who they don't have cavities and gum disease, but instead they have a lot of recession, or they have a lot of areas where they have sensitive teeth. The ideal toothpaste for them, do a baking soda toothpaste or a Sensodyne toothpaste, the original brand of Sensodyne. Those two toothpastes have been proven to be the most gentle on the teeth and gums. There are folks where they don't have any issues with their gums, they don't have any issues with sensitivity, no cavities, or gum disease. But their main focus is aesthetics, or the removing all the stains off their teeth. And the two main toothpaste would be a whitening toothpaste or our charcoal-based toothpaste. Both have been proven to be equally effective in removing the stains from the foods that we eat. Now, with those toothpaste, we don't want to brush too hard because they are more on the abrasive side. If using it properly, there should not be any real issues whatsoever. The whitening toothpaste that I personally use is also from Sensodyne. It's pro enamel, actually. It's like a gentle white. I find that to be enough. So if there are people who, their foods are more heavy in stains, or their body just naturally produces more stains on their teeth, they might require a much more abrasive whitening toothpaste.
Next question is, what brand of floss should I use? All right, awesome.
I would just go with any type of waxed floss. Those tend to glide in between the teeth very gently, and they are rather easy to use. There are folks who would actually also benefit from not just a regular floss, but a water flosser as well. So for the brand of water flosser that I've seen to have probably one of the best track records, thing really is Waterpick. They've been around for a long time. If you have an implant, if you have a bridge or an advantage, the Waterpick tends to be the best option in combination with flossing. So wax floss is the best. And sometimes a lot of people, they will actually have a bag of the flossers where it's tied onto the stick. Now, those flossers, they are fantastic. I will use it as well after lunch or anything like that, but I will not rely only on those types of flossers, because you are limited to which areas that you can floss with for those flossers because of the angle. Most of the time, the patients that come in and we're checking their teeth and cleaning their teeth, and they rely only on those flossers on the stick, it's the very last molars in the back that tends to still catch a lot of food, still tends to get a lot of buildup, and potentially leading to gum disease in behind the very back teeth. But they have come out with other flossers on the stick that's at a different angle as well. So if you do want to use the floss on the sticks, you'd have to buy both of them. One that's kind of at the same angle and one that's turned 90 degrees.
Right. So at what age do children get their first tooth?
On average, it would be 6 months. At the 6 month mark is when we start to see the two baby teeth on the bottom starts to grow out. And then, of course, the next two would be the top two. There have been reported cases where the baby will come out of the womb with teeth as well. So those can be a little bit more unfortunate for moms that are breastfeeding. But usually around the 6 month mark is when we'll start to see teething. So that's when we might want to have those ice popsicle sticks ready to kind of help with the teething situation there.
So when should I take my child to the dentist for the first time?
With babies as early as 3 months, to tell you the truth, because at the 3 month mark, when we see the baby, of course, there's no teeth yet. However, we can instruct the mom or the dad on how to kind of scrub the gum. You're really training the baby is every day to have something that's going into the mouth that's cleaning. But if you keep at it at a much younger age, they just become more acclimated to it. Just like you taking the baby to the pediatrician, when you take them enough times, they start to get used to it. They start to kind of know what's going on, and it doesn't scare them when they become older. And so it's two things: to get them acclimated to seeing their doctor, their dentist, and us kind of coaching you guys on all things oral habit and cleaning. So the start of 3 months is the youngest that I've seen it, but definitely by 6 months. And if there's any weird situation where the tooth is growing in wrong, we can catch it as early as possible.
So can babies get checked at the dentist too? What is the process for that? That's basically a
Oh,
similar
yeah.
question, but someone else asked it.
Yeah, no, absolutely. With babies, of course they're really small and they can't lay on the dental chair, but as you can see on the photo right there, that's exactly how we would do the examination for babies. You would hold the baby would be sitting on your lap but facing you, and you're hugging the baby, and the doctor will come up from behind the baby, and all you do is lay him back, and he'll just lay on top of your knees, and then his head will kind of lay on top of the doctor's knees. And from there, we're able to check and count the teeth and get the baby getting used to another doctor or another person. Absolutely, we see babies all the time starting at 3 months.
So my dentist says I have a cavity and I need a filling. So why doesn't my tooth hurt?
It's a good thing that we don't have pain from a cavity, but it's also a bad and unfortunate thing that we don't get any warning signs when we have a cavity. So our tooth, the center of the tooth, is a nerve. Through evolution, that nerve can only send one type of signal, and that is pain. Even if you feel cold, that's technically still the same pain sensation as a toothache, but it's like super, super, super cold. And so nerve is at the center of the tooth. Like a M&M, the outer shell of the tooth is rock hard. The inner core of the tooth is chocolatey soft. It's 7 times softer than the outer enamel shell. Now, the enamel shell and the inner core, which is what we call the dentin core, they both insulate the nerve and protect the nerve from all the temperature changes, from all the pressures that we put on our teeth when we're chewing and eating foods. When a cavity starts, it starts like a termite, starts burrowing a small hole from the outer shell. And right when it breaks through the outer shell and it gets to the inner dentin core, it can grow in an accelerated rate and it sort of expands in size from there. Whereas with the enamel, it has to eat its way through a tiny little hole in order for it to make it through. The core of the tooth is still insulating the nerve quite well, but there comes a point in time where when the bacteria has dug a hole big enough and has eaten away enough of the insulation between the nerve and the bacteria and the cavity, that's when you finally start to actually feel some pain. And usually by the time we feel pain, it's because the cavity has gotten close enough to the nerve to start to trigger the nerve to have reaction. So the reason why there's no pain is because, Mother Nature has designed the tooth in a way to insulate the nerve. But once the insulation has been stripped off of the tooth can start to become very sensitive. And that's usually when it's too big.
So how safe are dental x-rays?
10 years ago, the x-ray technology that was available to us definitely was much higher in dosage, higher in radiation. With the advancement of technology, we have now switched from a regular film that needed to be processed through liquids, special liquids, to now a digital sensor. And with the digital sensor, we only require 1/10, if not 1/20th, of the amount of exposure in order to capture a clear image of the tooth. The amount of radiation that is being used in a dental office for imaging, it's less radiation than you getting on an airplane and flying over to Florida and back for a vacation. Vacation on an airplane actually has way more radiation than you could possibly get from a dental office nowadays. The x-rays are handheld, meaning in the past, we ourselves, the operator, would have to be 6 feet away from the image, from the machine while the image is being taken. I wouldn't be concerned at all. There also has yet to be a single case of reported cancers due to dental x-rays. It's so safe now that we're also able to take dental x-rays during second and third trimesters now. But after the first trimester, we're able to take images and do dental work and everything without any restrictions whatsoever.
All right, so that's it for our questions today. Like, subscribe, and give us a thumbs up on all of our social media platforms. Thank you.
Awesome. Thank you, everybody. Take care.